A lot to unpack there, doctor. Help us also maybe in just a few sound bites and in layman terms, how just the vaccines help build immunity as well. And I remember when I got mine, they told me give it about a couple weeks before you really know that it's done its duty, let's say.
Right. Right. So what the video was trying to show was that the messenger RNA goes in and creates the spike protein that is on the surface of the COVID antigen. And what happens is when you have that protein, our body will recognize it and see it as a foreign entity and create antibodies to attack it. So that's great because this is what your body normally does when it's introduced to a virus or a bacteria or an illness. And so instead of having to get the actual virus, you can have kind of this false, I'd say, reaction where you create this protein without actually having the virus, and then your body creates antibodies to attack it. Once those antibodies are created, we keep them in our body's memory. So in the event that we are actually exposed to the true virus, our antibodies have already been created and they come back again and they try to fight and break up that protein. So we will always have immunity.
All right. And one concern that I have from a parent, and I got no name here, but I do have the question, can the COVID-19 vaccine affect fertility in the future? And that is obviously the concern of maybe a teenage daughter receiving the vaccine and having that problem when she wants to become a mother. Have you heard that question from your patients?
Yes, I've heard that question quite a bit, and I wasn't sure really what the genesis was of the question because we've all received many vaccines and there's never been a vaccine to affect fertility. I'm not sure if it's the fact that it is an mRNA vaccine that causes the concern, but again, because the mRNA does not live long and does not affect our DNA, there is no way to affect your fertility. So they
Okay,
should not be worried about that.
good. I'm glad we covered that. Okay, so during the pandemic, I'm just wondering about this as well. I wonder how many parents did not take the children in or their child to get vaccinated. Have you seen a lower number of kids keeping up to date with their vaccinations?
We did. It happened probably 6 months ago or so, but well, sorry, before 6 months, but now everybody's back. They're totally catching up. Everybody's coming into the office and trying to be up to date with the vaccines and physical forms. So thank goodness everybody is really doing a great job in trying to maintain immunity and maintain good preventative health.
Fantastic. We have a few more questions from our viewers, but I do just want to remind anyone who's just tuning in right now, if you have a question for our expert, it's very easy. All you have to do is email us questions at allhealthtv.com. That's why it's Dr. Q&A. And our phone number, 855-796-4475. And of course, you can always check out our website, and that's allhealthtv.com. Doctor, we have another video question from Daniela. That happens to be my daughter's name. Let's see what her question is. Let's take a listen.
Hi, yes, I am the mother of a 2.5-year-old daughter who is very close with me as far as attachment, especially through this entire pandemic. She will be starting school in the fall, and one of my biggest concerns is just a heightened separation anxiety that may come from or as a result of the pandemic and any long-term effects that this will have on her just overall anxiety and or fear from being away from me.
Great question.
It is really a great question. And it has been a tough time because, to be honest, a lot of children have been with their parents 24 hours a day, and they're not used to being left with a babysitter or going to school. And so there is a bit of separation anxiety involved, absolutely. And my advice to Daniela is right now to start preparing her daughter. And what I mean by that is, introducing her to her bedroom and letting her play in there for a little bit and having kind of her time alone in her room, just so she knows that that's her safe place and she can be left there and not need to go look for her mom. So encouraging encouraging individual or independent play at home is the first step. And then little by little, showing her the school and reading books to her about going to big girl school or daycare, and just showing her that the separation is normal, and just preparing her for the steps that are coming in the future. The best way really with children is to always prepare them and be open with them and transparent with the events that are going to take place. So she will be fine with the separation. It will be difficult initially, but if she prepares her slowly over time and talks to her and allows her to see that independent play or independent activity is totally fine and mom will always rejoin you, that's usually the best way to handle it.
Fantastic. Thank you, Daniela. I have a question here, and this one I find to be interesting, and I'm sure this has happened a lot in your office. What should I do if my child has symptoms of coronavirus? I mean, let's not forget that children do get sick. Children do get colds. Children cough.
Yes.
But now you just hear,
Right.
oh, and people go, corona. So what do you do? Because the fear is so great.
It is. And this is what we're going through right now. I mean, on a daily basis. When the children do have your upper respiratory symptoms, such as a cough, runny nose, or cold, usually what we do is we screen the parents on the phone first, and we ask a couple preliminary questions. And if the risk of them or the likelihood of them having COVID is low, we have them come in and we're happy to examine the kids right away in the office. We really don't want to encourage families to go get tested at the sign of the very first symptom. The idea is to wait for symptoms to progress and let your physician see you first and examine you. And if all else is ruled out and maybe COVID is still on the table, or there was some type of exposure, or there is a suspicion that perhaps the child was exposed, absolutely we recommend testing. But remember, it's very odd for a family who doesn't have any symptoms at all, and let's say both parents work at home, the child doesn't go to school, to just have COVID, an isolated incident of COVID. Those situations are less likely. So we really assess the situation, we ask a detailed history, and then we go from there.
I have another question from a parent who has a college student, and this is actually my scenario as well. If my child, which is now an adult, got COVID in college, should she get the vaccine? And I can say the same for my daughter, Samantha. She got COVID. And I also want to follow up with one doctor that I'm just going to throw in too, if you don't mind. Do you think it would
Sure.
be beneficial if children, again, college students, get the vaccine and it's mandated in some colleges or all colleges?
Yes. So as far as having COVID in the past, that, the protection that you have or the antibodies that you created from having COVID have been proven to last about, they're saying 60 to 90 days, but its efficacy is pretty much unknown. So you are not protected from getting COVID again if you have actually had COVID. And I know that's counterintuitive when I explain the mechanism of the vaccine, but what happens with vaccines, it's almost like a super response. So while you did create antibodies by getting the actual virus, those antibodies were created and the efficacy wanes down and goes away over time. Whereas with a vaccine, it's almost like a super response. So you're able to create a better response, more antibodies, and more effective, and that lasts much longer. And we still don't know yet how long the vaccine is effective, but we know for sure at least 6 months for right now until the studies are done again. And so what I'm saying with that is that you should definitely get vaccinated to protect yourself from getting COVID again.